may know her as the former Deputy Director of the Animal Care Center in Austin, Texas, but we now all know her as the Animal Care Director for the Pima County Animal Care Center in Tucson, Arizona. And also, she is affiliated with American Pets Alive. So, welcome, Kristen Auerbach. How are you?
Thanks so much for having me, Catherine. I don't know about you, but I feel like this might be the first week where we're like, okay, this is life as we know it now. There's not as much shock and surprise. It's more sort of getting used to this new way of running animal organizations. Yeah, I think it was about 5 weeks ago. I was sitting around with Dr. Levy and Suzanne Kogut from Petco Foundation, and we were sort of saying, this COVID thing seems like it could be bad. And we decided then to make a Facebook page while we were sitting there, I think having our coffee. And we thought, well, if nobody needs to use this page, we'll get rid of it, but why not have it there? And today that page has 700 animal welfare leaders on it. We meet weekly to talk about emergent issues. And it's really been an important source of connection. So it's been really an unprecedented time, and it's been this time of tragedy and this time of sort of rethinking animal sheltering.
But what is behind you?
Well, one of the things that became apparent really quickly was that if we were going to be operating in a totally different way with most of our pets in foster homes and only serving the public through appointments, that we were going to have to really think differently about how we utilized our staff. And so our team has been working for the last week on a sort of a dream org chart that has 3 sections. Part 1 is One Health. So that's our field services, animal control, outreach, and pet support. Part 2 is outcomes. So anything related to getting a pet out of the system. And part 3 is sheltering itself. So it's a really different way to think about animal sheltering. And we have all these new ideas for positions. We have one we're working on this week called a Getting Pets Home Specialist that is there's going to sort of be like Uber return to owner counselors, where they're going to do all the legwork. They're going to really help people because we need to keep our shelter population down. And I think increasingly we're going to have to be really savvy and innovative if we're going to do that. But PAC has one of the highest per capita intakes in the nation. So we're not a very huge community. It's Tucson and the surrounding county, but it covers 9,000 square miles. Last year we took in about 19,000 animals. So at any given time, we would have 500 to 600 dogs housed at PAC, and anywhere, depending on the season, up to 500 or 600 cats. Right now, we'd be looking at an inventory around 800 to 900 animals, and that inventory today is 120, I believe. So it is we have lots of empty kennels, and we need them for what's coming. And most of our pets are housed in foster. I think we have 1,100 pets in foster and about 120 in shelter. So we are following the NACA guidelines that talk about what is essential intake and what is non-essential intake. So we're only taking in pets that really need to be here. And that includes sick and injured animals, victims of cruelty and neglect, dogs that pose a public safety risk. And then there's that sort of gray category of owner-surrendered pets and stray animals where the person connected to that pet really can't help it and it still needs to come into the shelter. So for those, we're managing them on a case-by-case basis and determining if that pet really needs to be in the shelter. Every pet that comes in, we're tagging it immediately for placement. Whether it's a stray, an owner surrender, whatever it is, even if it's getting medical care, we're identifying a placement from the minute it comes in so that it can leave as soon as possible. And really, I think we've heard a lot of reasons why this is important. I think it's important, one, because puppy and kitten season is around the corner. And last year, between May and June, we took in about 4,000 pets. That's a huge number. And even though we have about 600 fosters on deck, we're anticipating a surge of animals. I think what I've learned over the last 2 weeks is that when we reduce that number, that is the number one way we can keep staff and volunteers safe. We still have volunteers here, so we're trying to minimize the human contact, which means having fewer animals here at PAC. And it's really done a lot to keep our staff and volunteers safe and healthy. So we do live videos every single day. We walk through, we explain what's happened, what we're doing. We send out regular volunteer communications, just updating everybody. We did a survey of our staff and we asked them what the #1 way we could help them was, and they said daily communications. I think the hardest part of all of this is we're asking the community to embrace a new way of doing things. We're asking them to hold stray pets. We're asking them not to surrender, to rehome their own animal. And yet that messaging is coming pretty hard and fast. And so increasingly, as this becomes the new normal, I think there's going to be a real push to go back to the old way of doing things. But as long as we need to maintain social distancing, that's not really a possibility. So our challenge moving forward is figuring out, how do we create a new community culture where we take a collective responsibility for pets during this time?
How do we not go back?
So every day my thinking on this sort of evolves every day, and it's a great question. One of the things that I think has surprised me is that we're providing the best customer service we've ever provided. But there's one reason for that, and it's because we're talking to people on the phone and we're talking them through video telehealth services. They're not standing face to face with us, and we're not dealing. I think we've really underestimated the pressure it puts on animal services employees to have a public wanting more services than any of us could ever provide at our shelters day after day after day. The lines of people waiting to surrender, the person trying to adopt who's been waiting an hour and a half and is really frustrated. All of that, I think, diminishes our ability to provide excellent customer service. And I think by moving most services now and in the future to the initial point of contact being via telephone or video, I think that's going to change things fundamentally for those services we can provide the public. So that's #1. And doing more through appointments, especially when it comes to intaking stray and surrendered pets. #2 is that we all have these great big shelters, and PAC it's been really interesting because we built a new shelter a couple of years ago, and it's amazing. It's 90,000 square feet, has 722 dog housing units and 500 cat housing units. And it really is a mega giant shelter. But we have to figure out how we help the public understand that shelter shouldn't be full, and that space maybe can be used for things like we've been thinking about, we have this whole empty kennel room, and we've been thinking a lot about, can we use that space to do disaster relief efforts or crisis support, response for anyone who's been impacted by COVID? You bring your pet in, we get you some basic medical care, we get you food and supplies. Could we totally re-envision how we use that? Could we start temporarily boarding pets for people who've been impacted by COVID and need to find transitional housing or are sick and need to be hospitalized? So all of these questions are coming up, and I think it's going to be how much we can get. We're bound in part by state laws. Most of us have laws that say we take in every stray dog, no questions asked. So it's going to require, I think, a national effort. And one of the things that I really appreciate about you and why what you're doing might change everything is that you've really been getting all the national orgs together to help advocate for some support for shelters and not bringing in all the animals. So I think that work you're doing is going to be the thing that makes this happen. And I think without it, we're all going to get so much pressure to go back to the old way. And then the very, very last thing I'll say is that most pets should be housed in foster. Anywhere between 50 and 90% of animal populations can and should be housed in foster, not in shelter.
Tell me what it's like to host those meetings every Friday where you have 250, 300 people sitting on a Zoom meeting, listening to you talk. What's that been like for you?
So we started this Friday meeting, and it's for really leadership. It's for veterinary medicine leadership, animal shelter directors, and national org leadership. And the intention of the call was just to talk about emergent issues. And I really wanted it to be a place where the shelters could tell the national orgs what they needed, and the national orgs could help inform how they move forward. And I think some of that has happened, but it's really also gone further than that I'm really just there to moderate and facilitate the call, but we're bringing in national experts.
If you were to predict the future for Kristen Auerbach, what does your future look like?
Well, I want to help lead shelters into taking a one health or one welfare approach to animal sheltering. I think that's where we need to go. I think that other sort of things have been emerging to indicate that. I think there is a need to connect human welfare, animal welfare, and the environment, and to really think holistically about those things. When we think about all of that together, it can lead us to, and I certainly don't have an answer for this problem, but it can lead us to ask different questions about how we can look at our overall impact in animal welfare. And that goes as well, that goes for helping people. So we have a robust program to help people experiencing homelessness with their pets. And you know, in the old days, we used to go, it gets to be like 100 million degrees here. And so dogs' paws were burning, and you've seen those pictures of dogs' paws burning. So in the old days, we would go and take that dog from the person and say, you're neglecting it and it has this medical problem and you can't own it. Well, now we have a program called Pup and Boots, and we buy tennis shoes for every single darn dog in Tucson who's living outside. So when you see street homeless dogs that are living with people experiencing homeless, guaranteed they're going to have a pair of tennis shoes. And if they don't, there's about 50 volunteers driving around who have some spares in their car and are going to hand them out. So that's the kind of way I think these are the kind of questions we need to start asking. And I really hope to help lead animal welfare into One Health. And I joined the One Health faculty at the University of Arizona last year with that in mind, to sort of move us forward to a new way of looking at our work.
Just thank you for your leadership and everything that you're doing to bring us together. Take care of you, take care of your team and your volunteers. Thank you for all the great work you're doing. And
thanks so much, Catherine, for everything you're doing. And thanks so much for having me.
Absolutely.